morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
It is Health Talk, brought to you by Mon General. Good morning, Kay.
Good morning, James.
Barbara Slaughter in studio this morning, or is it Barb or is it Barbie?
Barb, I believe.
All right, well, it is your name, whatever you want to be called, Barb. That's fine. And she is with Mon EMS. She's a paramedic captain, and today we're going to be discussing strokes, the different types of strokes, who's likely to have one, risk factors, and how important it is to get you in a Mon EMS ambulance quickly to the hospital. And, I was thinking this morning, too, and I mentioned it to you, Randy Travis. Of course, he goes into the hospital in Baylor with congestive heart failure, and now he suffers a stroke yesterday as well, and that is sad, and he is back in critical condition. And we hear about people getting strokes. Obviously, people survive strokes. Yes. A lot of times, then they're limited in somewhat of their mobility. But you're on the front line there when somebody makes a phone call and says, I'm not sure what's happening to my husband here. You obviously, or 911 asks, what are the symptoms? What's going on? What are some of the symptoms of the initial signs of a stroke?
A lot of times people will have a deficit, a weakness on one side of their body. They will have slurred speech. They will have, they may actually just pass out.
The weakness on one side of the body or the numbness, is that because the stroke is happening in one half of the brain and that half controls one half of the body?
There are two types of stroke. All strokes are an interruption in the amount of oxygen going to the brain. There is the ischemic stroke. That is a blood clot in the brain that stops the oxygen going. And there is a hemorrhagic stroke, which is a bleed in the brain. And that, too, interrupts the amount of oxygen you're getting. Each type of stroke can be treated, obviously. If you're having a blood clot in the brain, then they give you drugs that they call clot busters, and that breaks it up. And if you have a bleed, they can go in there and drain the blood off the brain, and hopefully that will fix it.
We're going to talk about that critical time window, too, of getting treatment. But for those of us listening this morning, wondering whether we're susceptible to strokes, how would we know that? Is it predetermined in any way through hereditary factors?
There are the hereditary factors. Also, men are more likely to have strokes. Men over the age of 55 are more likely to have strokes. Also, African Americans and Pacific Asian Islanders and Hispanics are more likely to have strokes. You can control some of the factors. You can control your cholesterol. You can control your high blood pressure with medicines. A good, healthy lifestyle will help you keep from having a stroke. So those are the things that, there are some things you can do.
It seems to me that if I have a proper diet and proper exercise, I'm not going to die of anything.
That may be true, but
no, I'm sure I'll probably have a more likely chance of dying of old age in my sleep if I have proper exercise and proper nutrition.
And that's true of all things. Everyone, needs to have a healthy diet and healthy exercise. That's just the smart thing to do.
Going back to the strokes and the symptoms, and you mentioned the weakness on one side, maybe trouble with walking and seeing and those things. Can some people get a side of their face that gets droopy? That's a good indication.
Yeah, that's another thing. We do an acronym. It's called FAST. And, of course, if you have any signs and symptoms, you want to call 911 and get to the hospital fast. And the F stands for the face. And you look at the person and you have them smile at you. Mm-hmm. And if they're droopy on one side, you may be having a stroke. A is for arm. And you ask the person to raise both arms in front of them. And if one drifts down and they can't hold it up, they may be having a stroke then. Speech, you have the person say a simple sentence. And if they have slurred speech, then you may be having a stroke then. And T is for time. And time is very important. You have like a 3-hour window in which the doctors can reverse the effects of stroke.
Can you have or be having a stroke and not know it?
Yes, you can. When we come and answer a 911 call, every time we will ask you, when did this start? When did you first notice a change in the person? A lot of times they'll wake up in the morning and you'll see a change in them. Then, we don't have a time because it happened while they were sleeping and they did not know that they were having.
But we're going to know something's wrong.
Most of the time.
And reacting to that quickly is the most important thing.
Absolutely.
We're going to know the difference between that and a heart attack. We're going to know and have different signs completely.
Yes.
Does age play any part in any of it?
Absolutely. Like I said, over the age of 55, the age becomes a factor. If you have a predisposition to atrial fib, which is an irregular heart rate, you have a higher likelihood of having a stroke.
Once you've had one stroke, does that mean you could have others?
Yes.
If you get to the doctor and to the hospital, can we lead a normal life after a stroke?
A lot of times you'll have what they call a TIA or a mini stroke, and that's just a transient stroke. And those leave very little effects. A larger stroke, you have the greater chance of having permanent effects.
But there are different types of strokes.
Yes.
And can we talk about some of those? And let's talk about maybe the mini stroke or the one that's the most mild. Start off with that one.
Okay, yes. The mini stroke, it can happen over just seconds. You may feel just momentarily dizzy. You may momentarily have some slurred speech or, the facial droop, but it goes away. Your speech returns to normal very quickly. Your smile returns to normal very quickly.
And then after that, what would come as more of a severe type stroke?
Okay, then a more severe stroke would be...
I'm sure there's names for all of these, medical names of some sort.
Well, no, there's only the ischemic, the mini stroke, and then then a stroke.
Okay.
So when you have a bigger stroke, which is a bigger clot in your brain or a bigger head bleed, something like that, the effects can be permanent. But if you get to the hospital in time, if you get in the 3-hour window, there are treatments that can be done that minimizes the amount of the effects and the period of rehabilitation.
But they can kill.
They can kill. If you have a large stroke and it's not treated, then yes.
And there's certain things when we go to the hospital, maybe a heart catheterization or some of the treatments that we have can cause a stroke, can cause us to have a stroke.
Yes, because anything that you do that would cause a blood clot to form, something as simple as your foot being injured. A lot of times you'll have a clot in your foot, it'll travel up, and that can cause a stroke.
And when we come back from the break, we're going to continue our conversation with Barb Slaughter about why it's so important to call 911 as fast as you can so that you can get that person to the hospital as fast as you can. Pick up the phone and give us a call if you have a question about strokes, 304-296-0041.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Mon EMS Paramedic Captain Barb Slaughter is our guest today. We are talking about strokes. When we call 911, how critical is it to get the patient or the person we think is suffering from a stroke to the hospital, that time window there?
It is very critical to get them there within the 3-hour time window, if at all possible. There are so many things, so many treatments that have just been developed within the last 10 years that can have a great effect on your rehabilitation. In most stroke cases, there's going to be some type of effects left over from having the stroke. But we want to minimize the effects. When your grandmother had a stroke years ago, you still see these people. They're weak on one side. They're unable to speak. Today, with the new developments, that isn't, so much the case. I see people every day that have had major strokes, and they are talking, they're walking, and they're living normal lives. And that's where we want to go with it.
We've talked about on this show the communication between the ambulance and the hospital prior to the patient's arrival at the hospital. So once you load a patient into your Mon EMS ambulance, what kind of treatment are you doing then to prepare for the arrival at the hospital?
Okay, the most important thing that we're going to ask you is, when did you last see him normal? That's very important. That tells us whether we're in that 3-hour window or not. And we're going to do what we call basic life support or advanced life support on this patient, depending on where they are in the stroke. We're going to give them oxygen, which helps get the oxygen to the brain, which is what the real problem is. And we'll probably give them an IV and fluids, and we're just going to support them till we get them to the hospital. Once they're at the hospital, then the doctors there are going to do a head CT to see whether it's a blockage or whether it's a bleed in the brain, and then they're going to base their treatment on that. If it's a blockage, then they're likely to give them medications that's going to dissolve that blood clot.
And they're likely to have all your vitals and everything at the hospital before you arrive or
Absolutely.
as you arrive.
We're in constant communication with the hospital, either through the radio or with a cell phone, and we let them know exactly what we're bringing them and everything about that patient before we get there.
And again, that's why we stress when someone is in stress like this to call 911.
Absolutely.
Do not try to transport them themselves. We stress that every time we do this show,
Right.
of how important it is to get an ambulance to your house.
Yes.
And of course, we talked about after a stroke and going back to your life, and hopefully you can do that and be as normal as possible. Is there physical therapy involved after a stroke at all?
In most cases, there is either physical therapy or speech therapy, occupational therapy, that type of thing. We have, wonderful area hospitals in this area that do that. Also, a lot of times, there's some in-home therapy that can go on. There are actually people that come into the home if you can't go, and they will actually do the therapy in the home.
We talked about risk factors, and you said lifestyle has a lot to do with it. The age can play into it, men, and also in risk factors, does stress have anything to do with it, and the type of lifestyle that we lead, and maybe different jobs or occupations?
Absolutely. Stress is one of the big causes. Smoking. These are the things that you can actually change, which is a good thing. There are things that you can do to prevent having a stroke. Go out there and get the exercise, lose a little weight, quit smoking. You can actually, one study shows that actually drinking 3 cups of tea a day
Helps?
helps.
What about 3 glasses of wine? Does it help?
I think anything that probably reduces stress may help.
It does
so find
reduce
it
stress.
works for you. That'd be good.
Oh, it's a good time to take a break, and we're all
Yes.
feeling good now that you can have tea.
Tea.
Yes, tea has those great antioxidants in it, right? 8:51, you're listening to Health Talk on WHAR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
2 basic types of stroke: ischemic, which are basically blockages of the artery, and hemorrhagic. Did I say that right?
That is right.
He's
Hey.
just bragging because he can do those words.
Well, no,
That's
because I was
all.
sent a link with the information, and I could just try to pronounce the words if possible. But
So impressed.
the hemorrhagic are strokes caused by bleeding. And so you've taken us to the hospital. Mon EMS has taken us to the hospital, and looks as though we've had a stroke. And then there's treatment that goes on at the hospital before eventually you're probably going to be taken to Health South or get into some kind of rehab to be able to get the speech back and the motor skills and those types of things. What kind of treatment does the hospital provide a stroke patient?
Well, the first thing they're going to do is find out exactly where your stroke is. If you have a stroke in certain parts of the brain, it's going to affect different parts of your body. And they'll do a head CT and find out exactly what's going on in there. And then they will either give you medications to break that up, or they're going to possibly, there's some new surgeries out there that they can actually go in through the artery and pull that clot out, which is really cutting edge.
All right. Now, if it's the more common type, the 87 ischemic type of stroke, which is a blockage in the artery, you're trying to unblock that in the ambulance, right? I mean, we do clot-busting drugs. Is that...
We do not do clot-busting drugs in the ambulance.
Okay.
There are some areas that do. In the other parts of the country, they're a little more advanced, maybe.
But how could you do that if you don't know what stroke you're dealing with?
Exactly.
Really?
That's always the concern about
you have
doing
to know
that.
what you're dealing with, I'm sure.
Right.
Which is where Mon General comes in.
Right.
And the expertise they have there, and I'm sure special doctors that work at and exist at Mon General. Thank God they're there because
they have a new neurologist on board right now. And they're actually getting ready to get accreditation as a stroke center.
Really? That's
Yes.
good to know.
Now, when you're looking at the CAT scan, is it looking for the part of the brain that's not getting enough oxygen? Mm-hmm. Does it show up as a different color? Or
It will. It'll be a darker, and you can actually, I don't read X-rays, but they can see that very clearly.
And then they can determine from there why the brain is not getting oxygen?
Exactly.
And determine what kind of stroke it is.
Yes.
Okay. Very interesting information. A couple minutes left in the program here today. So what else does the hospital do as far as treating us?
Well, once they've taken care of whether it's a clot or bleed, the hospital actually keeps you there for a few days to stabilize you, and they do some rehab in the hospital. The nurses are great. They get you up and get you moving again.
Yeah. But, the unfortunate thing we learned from earlier in the program from Kay's question is that if you've had a stroke, you are susceptible to further strokes.
That is true.
But people probably can, change your lifestyle, I suppose, and prevent, maybe not prevent, but reduce the likelihood, right?
This is true. And, again, a good, healthy lifestyle will keep you out of trouble on many levels.
All right, so I want to recap with you the time we have left, some things to know when you call 911. So if we suspect that our husband or wife is behaving differently and we call 911, they're going to ask us some questions. What are some things that we need to know?
First thing they're going to ask is, what time did this start? Okay. If you notice facial droop, slurred speech, ask them to lift their arms up. If they can't keep one arm up, they're weak on one side, they have trouble speaking, then, definitely call 911, and they're going to ask you, what time did you notice that this happened?
Ask the patient to smile. Ask the patient to raise their arms. Ask the patient to say a simple sentence like, the sky is blue over West Virginia.
And time is crucial. Call 911 immediately. That can save your life. It really can.
All right, Barb. And what's that telephone number for 911?
I believe it's 911. Jim.
All right, thank you. Barb Slaughter, she is a paramedic captain with Mon EMS, and today's topic has been stroke. A video of this program will be available in the very near future. Believe it or not, you're going to be on the Mon General website, Barb, along with Kay and me. So, they're all archived there. We want to thank you for coming in today. Appreciate it. You got to go back to work now?
No, have a day off.
Hey, good for you. All
Was
right.
a day off.
Yeah.
All right.
Oh, she's going to have a stress-free day, which we all should try to achieve. Stay tuned for Morgantown AM with Kay and Jim. It's coming up next after the news on the Voice of Morgantown, 1440 WAJR.